Going through practice questions is by far one of the most effective ways to prepare for the TMC exam. After seeing a student's exam scores, I can always tell which ones used practice questions to prepare and which ones didn't. This is why I always recommend this strategy for each and every student. And the good news is, in this video, we have compiled a few practice questions on some of the topics that you must know for the exam. Hopefully, this will help you feel more prepared and get you one step closer to earning that RRT credential. So if you're ready, let's get into it. A 58-year-old postoperative male who weighs 172 pounds is receiving volume control assist control ventilation with the following settings: rate of 16 breaths per minute, tidal volume of 550 milliliters, and FiO2 of 40%. His ABG results are as follows: pH of 5.1, PaCO2 of 30, bicarb of 23, base excess of -1, PaO2 of 117, and an SaO2 of 99%. Based on this information, which of the following would you recommend? A. Discontinue mechanical ventilation. B. Administer IV bicarbonate. C. Increase the peak flow setting. Or D. Decrease the minute ventilation. Do you know the correct answer? Let's break it down. The first thing you need to do is interpret the ABG results. The pH is increased, the PaCO2 is decreased, and the bicarb is normal. This can be interpreted as acute respiratory alkalosis. Since the PaCO2 level is decreased, it means that the patient is blowing off too much CO2. In other words, they are hyperventilating. So in order to correct the problem, we need to increase the PaCO2. And to do so, you must decrease the minute ventilation. Now, in general, there are two ways to decrease the minute ventilation. You can either decrease the rate or decrease the tidal volume. To take it one step further, you can use the patient's ideal body weight to determine if the tidal volume is set appropriately. So we would say 172 pounds divided by 2.2, which would give you an ideal body weight of 78 kilograms. And at that weight, a set tidal volume of 550 milliliters is within the appropriate range. And this tells us that in order to decrease the minute ventilation, we would need to decrease the set rate. None of the other answer choices really make sense in this situation either. So by taking everything given to us in the question and breaking it all down, we could determine that the correct answer has to be D, decrease the minute ventilation. A 43-year-old male patient was admitted to the emergency department with a suspected drug overdose. The patient is receiving oxygen via non-rebreather, but is unconscious and isn't making any respiratory efforts to breathe. The patient's body weight is 57 kilograms and his ABG results are as follows: pH of 7.28, PaCO2 of 64, bicarb of 22, and a PaO2 of 315. Which of the following would you recommend? A. Apply BiPAP with an IPAP of 20, an EPAP of 5, and an FiO2 of 30%. B. Intubate and apply SIMV with a tidal volume of 600, a rate of 6, and an FiO2 of 40%. C. Intubate and apply assist control ventilation with a tidal volume of 450, a rate of 12, and an FiO2 of 40%. Or D. Apply CPAP at 10 centimeters of water pressure with an FiO2 of 100%. Let's break it down and see if we can come up with the correct answer. First, we must interpret the ABG results. With a decreased pH, a normal bicarb, and an increased PaCO2, this tells us that the patient is in acute respiratory acidosis. This, along with the other information that we gathered in the question, lets us know that the patient is in need of full invasive ventilatory support. So that means we can rule out A and D automatically because BiPAP and CPAP are forms of non-invasive ventilation. Now we just need to figure out which remaining option is the best for this patient. SIMV mode at a rate of 6, which by the way is very low, is only going to provide partial ventilatory support, so that means we can rule that one out as well. The best option for this patient is assist control ventilation at a normal rate with an initial tidal volume of about 8 milliliters per kilogram of body weight. Now the question gives us the patient's body weight, which is 57 kilograms. So now we can just say 57 multiplied by 8, which gives us 456 milliliters. And that is close to the tidal volume that is given in the answer choice, which tells us that this tidal volume setting is appropriate. And just a quick note about the FiO2. The patient has a PaO2 of 315 torr due to being on a non-rebreather. That number is way too high, which means that the patient has been getting too much oxygen. So now we know that we need to decrease that amount. In general, an FiO2 of 40% is a good starting point, and we can continue to monitor the patient and reassess at a later time. So by breaking down the question and going through all the data that was given, we can determine that the correct answer has to be C. Intubate and apply assist control ventilation with a tidal volume of 450 milliliters, a rate of 12 breaths per minute, and an FiO2 of 40%. Are you still with me? Before we move along to the next question, I just wanted to let you know about our TMC Test Bank. It's our massive bank of premium practice questions that many students have been using to prepare for and pass the TMC exam. Going through practice questions is by far one of the most effective preparation strategies, and that is why so many of our recent students have been successful. Our practice questions cover every topic that you're required to know for the exam, including the topics that, unfortunately, many students forget to study. If you're interested, we're actually running a temporary promotion that you can take advantage of. Just pause this video and visit the link below before the promotion ends. I'll drop a link right below this video down in the description. Okay, now that you're back, let's go ahead and break down another practice question. Is that cool with you? Alright, here we go. During the ventilator check of an adult patient who weighs 77 kilograms, you note the following settings. An exhale tidal volume of 550 milliliters, peak inspiratory pressure of 30, high pressure limit of 65, low pressure alarm of 20, and a low tidal volume alarm of 500 milliliters. Which of the following changes should be made at this time? A. Increase the set tidal volume to 700 milliliters. B. Increase the low tidal volume alarm to 535 milliliters. C. Decrease the high pressure limit to 40 to 45 centimeters of water pressure. Or D. Decrease the low pressure alarm to 10 centimeters of water pressure. Do you know the answer? If not, no worries, let's break it down. To answer this one correctly, you needed to have a basic understanding of ventilator settings and alarms. This is definitely a topic that you should spend some time on when preparing for the TMC exam. For this patient, all of the settings are acceptable except for one. The tidal volume, peak inspiratory pressure, low pressure alarm, and low tidal volume alarm all appear to be set appropriately. However, a high pressure limit of 65, on the other hand, is way too high for this patient. As a general rule of thumb, the high pressure limit should be set 10 to 15 centimeters of water pressure above the peak inspiratory pressure. Otherwise, the patient has an increased risk of barotrauma or lung injury if too much pressure is applied to the lungs. Now for the patient in this question, their peak inspiratory pressure is 30, which means that the high pressure limit should be set between 40 to 45 centimeters of water pressure. So by breaking down the question and using what we know about ventilator settings, we could determine that the correct answer has to be C. Decrease the high pressure limit to 40 to 45 centimeters of water pressure. A 74 kilogram male patient is intubated and receiving volume-controlled, assist-controlled ventilation with the following settings: an FiO2 of 50%, set rate of 15 breaths per minute, and a set tidal volume of 550 milliliters. The patient's total respiratory rate is 29 breaths per minute, and the following ABG results were obtained: pH of 7.53, PaCO2 of 27, bicarb of 23, base excess of -2, a PaO2 of 82, and an SaO2 of 97%. Which of the following would you recommend? A. Increase the FiO2. B. Increase the set rate. C. Increase the set tidal volume. Or D. Add mechanical dead space. Do you know the answer? Let's break it down. The first thing you should do is interpret the ABG results. So by looking at the data that was given, you can see that the pH is increased, the PaCO2 is decreased, the bicarb and base excess are normal, and the oxygenation values are satisfactory as well. So this ABG can be interpreted as acute respiratory alkalosis. This basically means that the patient is hyperventilating and blowing off too much CO2. That is what's causing the pH to be increased outside of the normal range. Since the PaO2 and SaO2 values are normal, you do not need to make any adjustments to the FiO2 setting. And looking at the patient's spontaneous breathing rate, you can see that it's already way too fast, so you definitely do not need to increase the rate. So that rules out A and B automatically. So next we'll look at C, which says to increase the set tidal volume. By looking at the patient's body weight, which is 74 kilograms, you can quickly check to see if the tidal volume setting is appropriate. So all you have to do is take the tidal volume of 550 milliliters divided by the weight of 74 kilograms, and that gives you 7.4 milliliters per kilogram. This value does fall within the normal range of 5 to 10 milliliters per kilogram, and this confirms that the tidal volume setting is appropriate. So now we can rule out C as well, and that means that only one answer choice remains, and it's to add mechanical dead space, which is the best option for this patient in this case. Adding mechanical dead space to the circuit is a method for treating hyperventilation. It works because the patient will essentially rebreathe the gas from their anatomic dead space, which will in turn increase the PaCO2 level. So for the TMC exam, please remember that if a patient is hyperventilating and has a decreased PaCO2, you should try to decrease the minute ventilation by either decreasing the rate or decreasing the tidal volume. But of course, not only that, you can also increase the amount of dead space, which will increase the PaCO2 value as well. So by using the process of elimination and breaking it all down, we could determine that the correct answer has to be D. Add mechanical dead space. A 176-pound male patient is intubated and receiving volume-controlled, assist-controlled ventilation with a set rate of 12, a set tidal volume of 550 milliliters, and a set FiO2 of 40%. An ABG was collected and analyzed, and a ventilator assessment revealed the following: pH of 7.39, PaCO2 of 37, a bicarb of 23, a PaO2 of 107, and the ventilator assessment revealed a spontaneous tidal volume of 180 milliliters, a spontaneous rate of 37 breaths per minute, a vital capacity of 550 milliliters, and a maximum inspiratory pressure of -12. Which of the following would you recommend? A. Place the patient on a 40% T-piece and monitor closely. B. Switch the patient to SIMV at a rate of 5 breaths per minute. C. Place the patient on CPAP and monitor closely. Or D. Maintain the current ventilator settings and reevaluate later. Do you know the answer? Let's break it down. To get this one right, you needed to be able to interpret the patient's ABG results and make the appropriate changes to the ventilator settings if necessary. Again, these are the types of questions in this format that you'll likely see a few of on the TMC exam. So the first thing you should look at is the ABG results. All of the values are within the normal ranges, so this ABG is normal. Then you can look at the bedside measurements that were obtained during the ventilator assessment. A spontaneous breathing rate of 37 breaths per minute is very fast. A spontaneous tidal volume of 180 milliliters is very low. And the vital capacity and MIP are decreased as well. All of these findings basically indicate that this patient is not ready for a spontaneous breathing trial and should not yet be attempted to wean from the ventilator. So in this case, it's best to maintain the current settings and reevaluate the patient at a later time. All of the answer choices that were provided, except for one, demonstrate some type of weaning. So that is something to remember. T-piece, the mode SIMV, and using CPAP, these are all methods that can be used to wean the patient from the ventilator. So by looking at all the data that was given in the question, you can easily see that this patient clearly is not ready for that yet. So you can rule them all out right away. And that only leaves one, which tells us that the correct answer has to be D. Maintain the current ventilator settings and reevaluate later. A 61-year-old male patient with emphysema is receiving oxygen via air entrainment mask at 45%. 1 hour after oxygen therapy was initiated, the patient appears lethargic and obtunded. Which of the following is the most likely cause in the change of the patient's status? A. Hypotension. B. Refractory hypoxemia. C. Respiratory muscle fatigue. Or D. Oxygen-induced hypoventilation. Do you know the answer? Let's break it down. First and foremost, you needed to recognize that emphysema is an obstructive disease that is classified as a type of COPD. Patients with COPD are typically chronic CO2 retainers, which means that their ABG results would show compensated respiratory acidosis. These patients are prone to oxygen-induced hypoventilation, which means that receiving high levels of oxygen can affect their ventilation to perfusion balance in the lungs. This ultimately causes an increase in dead space ventilation and thus an increase in the PaCO2 level. So for COPD patients, it is recommended to provide an FiO2 that is low enough to keep their PaO2 in the 50 to 60 torr range. This is equivalent to an SpO2 of 85 to 90%. With that said, this is where a lot of confusion comes into play for many students when covering this topic, because sometimes they are scared to give any oxygen to the patient just because they have COPD. And that is a big mistake and that is a big misconception. Yes, you should be careful and be mindful of their condition, but always remember, you should never deprive oxygen from a patient in need just because they are a CO2 retainer. Hypoxemia is still hypoxemia, no matter if the patient has COPD or not. So as a respiratory therapist, you still need to treat these patients by providing adequate amounts of oxygen. Just be aware that for patients with COPD, if you're providing an FiO2 that is too high for too long, you may run into some issues. So after breaking it all down, we could determine that the correct answer has to be D. oxygen-induced hypoventilation. You are called to administer acetylcysteine to a 66-year-old female patient. This medication can be helpful in treating which of the following conditions? A. Bronchospasm. B. Mucus plugs. C. Pleural effusion. Or D. Pulmonary hypertension. Do you know the correct answer? Let's break it down. First and foremost, to get this one right, you simply just needed to know that acetylcysteine is another name for the drug Mucomyst. And of course, Mucomyst helps to break down the disulfide bonds of mucus, which thins and helps mobilize secretions. This is definitely useful in patients with mucus plugs. Mucomyst is not used to treat bronchospasm, so we can rule that one out right away. In fact, it can actually make the patient's bronchoconstriction worse, which is why you always want to administer a bronchodilator when Mucomyst is given. And it would not be helpful in treating a pleural effusion or pulmonary hypertension, so now we know that the correct answer has to be B, mucus plugs. A 55-year-old male patient with a pneumothorax has a pleural drainage system in place. Upon assessment, you note that there is no bubbling in the suction control chamber. After confirming that suctioning is turned on, which of the following would you recommend? A. Increase the power of the suction control. B. Withdraw the chest tube about 3 or 4 centimeters. C. Check the connecting tubing for leaks. Or D. Add more water to the suction control chamber. Do you know the answer? Let's break it down. For the TMC exam, you definitely need to be familiar with chest tubes and pleural drainage systems. Here are a few tidbits that you should remember. If there is no bubbling in the suction chamber, this means that there could be a leak in the system, or in some cases, you may just need to increase the vacuum suction pressure. On the other hand, if there is bubbling in the water seal chamber, this is normal when a pneumothorax is present. This lets you know that the air is being drained properly. However, the bubbling in the water seal chamber should not be continuous. It should be sporadic. If there is continuous bubbling, it means that a new leak has developed. In this case, you should check for a loose connection. If the collection chamber becomes full, you should clamp the chest tube and exchange the system with an empty chamber. And if there has been no change in drainage, there may be a kink in the tubing. So taking everything into consideration, since there is no bubbling in the suction chamber, this tells us that the correct answer has to be either A or C. But the question states that the suctioning is turned on, so the best thing we can do in this case is to check the tubing to see if it has any leaks. Which means that the correct answer is C. Check the connecting tubing for leaks. A 43-year-old female patient in the emergency department was just orally intubated with an endotracheal tube. Which of the following would you initially recommend in order to confirm that the tube is in the proper position? A. Auscultate the patient's chest and abdomen. B. Perform a stat chest x-ray. C. Use capnography to verify exhaled CO2. Or D. Observe chest wall movement. Do you know the answer? Let's break it down. For the TMC exam, you must know how to confirm that the ET tube is in the proper position. This question is kind of tricky because the answer choices are all correct methods of confirming tube placement. The keyword in the question is the word initially because the question requires that you know which one to perform first. So immediately after intubation, the first thing you should do is auscultate the lungs in order to listen for bilateral breath sounds. You should also auscultate the abdomen as well, and there should be no air movement, otherwise you can suspect that the tube is in the esophagus instead of the trachea. As I said, all of the answer choices are appropriate and should be performed, but just know that auscultation is what should be performed first, which means that the correct answer has to be A. Auscultate the patient's chest and abdomen. A 64-year-old male patient who is recovering from post-abdominal surgery has been on a high-flow nasal cannula at 20 liters per minute for 3 days. The patient's ABG results are as follows: pH of 7.39, PaCO2 of 43, PaO2 of 157, SaO2 of 99%, bicarb of 24, and a base excess of +2. Which of the following is the best action to take at this time? A. Decrease the flow. B. Decrease the FiO2. C. Decrease the flow and FiO2 together. Or D. Switch to a standard nasal cannula. Do you know the answer? Let's break it down. The first thing you need to do is interpret the patient's ABG results. We can see that the acid-base status is normal because the pH, CO2, bicarb, and base excess are all within the normal ranges. However, the PaO2, on the other hand, is increased. So this tells us that we need to decrease this value, and we can do so by decreasing the FiO2 setting. In general, for a high-flow nasal cannula, you need a flow of at least 20 to 30 liters per minute in order for it to function properly and deliver the set FiO2 to adult patients. So if you were to decrease the flow below 20 liters per minute, it's not going to provide the set FiO2 adequately. And in general, you should usually avoid adjusting two parameters at the same time. So by using our ABG interpretation skills, as well as what we know about high-flow nasal cannulas, we could determine that the correct answer has to be B. Decrease the FiO2. An adult patient with fluid overload was given a dose of furosemide intravenously. After the drug was given, the patient displayed an arrhythmia on the EKG that was not present before. Which of the following would you recommend in this situation? A. Defibrillate the patient. B. Administer another dose of furosemide. C. Administer a dose of epinephrine. Or D. Check the patient's potassium level. Do you know the answer? Let's break it down. First and foremost, you needed to know that furosemide is another name for Lasix, which of course is a diuretic agent that is given to patients with fluid overload. In general, you need to know that when Lasix or any diuretic agent is given, it's normal for the patient to excrete a large amount of potassium. And remember that potassium levels are associated with the heart, so this explains why the patient has a new arrhythmia. There is no indication to give more Lasix, nor is there an indication to give epinephrine. Also, there is no indication for defibrillation either. So by using what we know about the administration of Lasix, as well as the process of elimination, we could determine that the correct answer has to be D. Check the patient's potassium level. During the assessment of a 56-year-old female patient, you noticed distinct distension of the jugular veins in the neck. Which of the following is the most likely cause of this finding? A. Systolic hypertension. B. Hypovolemia. C. Obstruction of the pulmonary vein. Or D. Right ventricular failure. Do you know the answer? Let's break it down. To get this one correct, you simply just need to know what jugular venous distension is a sign of. As previously mentioned, Jugular venous distension presents when the jugular vein is noticeably bulging in the side of the patient's neck. This is a sign of right heart failure and is often seen in patients who are fluid overloaded. This means that we can rule out B right away. And none of the other answer choices really support what we know about jugular venous distension either, which tells us that the correct answer has to be D, right ventricular failure. A 52-kilogram female patient is receiving volume control, assist control mechanical ventilation with a tidal volume of 400 milliliters, a set rate of 10, and an FiO2 of 35%. Her ABG results are as follows: pH of 7.31, PaCO2 of 49, bicarb of 24, base excess of -2, a PaO2 of 84, and an SpO2 of 95%. Based on the given information, which of the following changes is appropriate at this time? A. Increase the FiO2. B. Increase the tidal volume. C. Increase the set rate. Or D. Maintain the current settings. Do you know the answer? We're about to break it all down step by step, but if you knew the answer before the explanation, let me know in the comments, just so I'll know where some of you guys stand. Now, to come up with the correct answer, the first thing we need to do is interpret the ABG results. A decreased pH with an increased PaCO2 and a normal bicarb indicates acute respiratory acidosis. And by looking at the PaO2 and SpO2, we can see that the patient's oxygenation status is satisfactory. So now we need to figure out what can we do to correct the respiratory acidosis to get the pH back into the normal range. The elevated PaCO2 level is what's causing the pH to be acidotic. This means that we need to blow off some of that excess CO2, and we can do so by increasing the minute ventilation. And you may be wondering, how can we increase the minute ventilation? There are two ways to do so. We can either increase the rate or increase the tidal volume. Now, the question provides us with the patient's weight of 52 kilograms and the set tidal volume is 400 milliliters. We can use this data to calculate whether or not the tidal volume is set appropriately. All we have to do is say 400 milliliters divided by 52 kilograms, and that equals to 8 milliliters per kilogram. And this falls perfectly within the appropriate tidal volume range of 5 to 10 milliliters per kilogram, which tells us that the tidal volume is set correctly. So since the tidal volume is set appropriately, that means that there is only one possible way to increase the minute ventilation. Now we can be certain that in order to lower the PaCO2, we need to increase the rate. So by going through the question, taking what they give us, and breaking it down step by step, we could determine that the correct answer has to be C, increase the set rate. Real quick guys, do me a huge favor and hit the like button. It really helps support the channel and I greatly appreciate it. And while you're down there, go ahead and click the subscribe button as well, because we have a ton of other videos on our channel that I think you will enjoy. I hope you like the practice questions that were shared in this video. Like I said before, going through practice questions is definitely one of the best ways to prepare for the TMC exam. Even if you don't use our practice questions, it's still a strategy that I highly recommend. If you do want to get access to all of our premium practice questions, you can consider purchasing our TMC Test Bank, which has already helped thousands of students just like you pass the exam. Also, you can get new practice questions sent straight to your inbox on a daily basis as well. If you're interested in either of these resources, check out the links below this video down in the description. Thank you so much for watching all the way to the end. Have a blessed day, and as always, breathe easy, my friend.